Blanca, Ecuador, Karen Topapila looks around the windowless reception area in the small healthcare station of Blanca, Ecuador, its pale yellow walls stained with patches of mold. When did the electricity go out last night? Topapila, a doctor in this remote corner of the country, asks. Her co-workers shrug, throwing worried glances at a small container filled with ice packs. It's only 8:30 a.m. one morning in December 2021, but outside it's already over 70 degrees. Topapila closes a cooler containing 52 COVID-19 nasal swabs. Those tests need to be refrigerated and we only have one fridge, which is exclusively for vaccines, she says. Her team has nowhere to store the tests, she adds, and so to avoid their spoiling in the jungle heat, the clinic wants to use up all of them on the same day. The very next morning, a healthcare worker is going to take them to the laboratory in the district hospital. Topapila, 25, and her team arrived in Blanca, a village of 600 located in the heart of Ecuador's Esmeraldas province, in September 2021. As freshly graduated healthcare professionals, they all are required to serve an año rural, working 1 year in a rural community in order to get their professional license or advance into postgraduate courses in medicine. The Ministry of Public Health implemented the año rural in 1970, and the practice is also common across Latin America. Topapila's team is the third deployed in Blanca since the start of the pandemic. The Blanca station is also responsible for 6 other communities, made up of mestizos, indigenous Chachis and Afro-Ecuadorians, about 3,000 people in total. Some of the communities are so remote that to reach them, the healthcare workers traverse thick rainforest and then travel by canoe for a whole day. Ecuador has suffered big losses from the pandemic. In the early months, corpses littered the streets of the country's biggest city, Guayaquil. By June 2020, the mortality rate from the virus reached 8.5%, one of the highest in the world at the time. As of June 5, 2022, the country recorded 35,649 official COVID deaths, although the real count is likely far higher. Many public health experts agree that COVID-19 has also surfaced deep-rooted systemic problems in Ecuador's rural healthcare system. In 2022, Ecuador, the smallest of the Andean nations, the population reached more than 18 million inhabitants, an estimated 36% live in rural communities. As with private healthcare providers, the country's public healthcare system is fragmented, divided among various social security programs and the Ministry of Public Health. There are about 23 physicians and 15 nurses per 10,000 people on average. But only a small portion of the country's healthcare professionals, roughly 9,800, by the estimate of John Farfan of the National Association of Rural Doctors, serve the more than 6.3 million rural Ecuadorians.